my name's Helen Elsey and I currently work with COMDIS-HSD, but I also worked with one of COMDIS's partners, HERD, in Nepal for a year recently, and we were, one of the projects we were working on there was looking at how to integrate smoking cessation or stopping tobacco use within primary care. We were particularly looking at working for patients who are suffering from respiratory diseases. So a key part of the project was really understanding tobacco use in Nepal. So just to give a bit of context, tobacco use is pretty high in Nepal, with about 52% of men and 13% of women. So for women, that's actually the highest across South Asia. So it's clearly an issue. There are no current sort of systematic smoking cessation services within primary care, so this is a real gap for all patients, not just lung health patients. To understand the issues facing lung health patients who smoke and the whole context of tobacco in Nepal, we started off by conducting some qualitative work. We did about 21 interviews with smokers, and we also did focus groups and interviews with health workers. And within those interviews, it came out very clearly that most of those smokers wanted to quit. They had often tried unsuccessfully, and really, while the health workers were very good at telling them that they should quit, actually telling them how to quit was a real challenge, and the health workers really recognised that they didn't have tools or the skills to be able to do that. The health workers were also very clear that they had very limited time when they were seeing patients. So taking all of these things into consideration from the qualitative work, we worked together with the health workers and also with the government of Nepal to come up with an intervention that could be used within routine care in primary healthcare centres. So the intervention involves, there's some posters that you can see one behind me, but there's also a flip book which helps the health worker to go through with the patient to really talk about their smoking, talk about trying to quit. It uses lots of behaviour change techniques. So for example, thinking through their motivations for wanting to quit, coming up with specific strategies. So when at kind of trigger points when they might think of having a cigarette, what they could do instead. So there are all these behaviour change techniques in a very clear flip book that can be used. So we felt that we'd really come up with an intervention that had a good chance of working. It was drawing on the qualitative work, it was drawing on theory and behaviour change techniques. But the next step was to try this in practice. So we used an action research approach where the HERD researchers helped the health workers to look at what was working and what wasn't working in terms of implementing that intervention in routine practice. And what came out very clearly from that was that often smokers would not be open about their smoking. So when asked as they came into the outpatient department, do you smoke, by the doctor, most would say they didn't. So actually getting patients into the intervention was a real challenge. Finding enough time for the health workers to do this intervention was also a challenge, as well as specific issues about which register to record smoking or not smoking in, and how this was seen as an add-on rather than part of the core work. We are now looking at and working very closely with the government of Nepal to look at ways of getting tobacco cessation within the routine healthcare and the routine systems within Nepal, and making it so that this becomes a core part of the work in primary healthcare centres.